I lost my daughter Denise to suicide on the 30th of September 2004. We didn't have no warnings. We didn't have any mental health issues with Denise. Denise was 13 years old at the time, and she just left a note saying she felt ugly and wanted to die. Following Denise's death, my son, who was 15 at that time, had mental health problems. He had suffered depression, and he got into a state where we were at our wit's end. We didn't know where to turn. We left the surgery that afternoon with nothing, with no referrals, with no medication, and my son just thought that the world had closed in on him, and he took his first overdose that Monday. To date, he has attempted to take his own life 11 times.
In 2006, a group of people bereaved by suicide joined with mental health service users to try and create change in the health system. They called this the Belfast Mental Health Rights Group. This film is about the process the group went through to create this change and about the lessons we learned along the way.
We use our own knowledge of our own experience, because a lot of us have had experience where we have had family members who have tried to take their own lives and haven't taken their own lives. And we use that knowledge to further the cause of the Belfast Mental Health Rights Group.
The group has campaigned for 4 years for a card before you leave, an appointment system that protects mental health patients who visit accident and emergency departments for treatment.
Anybody who goes to hospital with a suicidal thought, self-harm, maybe took an overdose, who doesn't need hospitalised, will get a fixed appointment in their hand to say that they will be seen by such and such at this date, this time, at this venue, within 24 hours to get a full psychiatric assessment.
So if they had something there, at least they're going to think, I have an appointment, I've got that, and their carers as well, because their carers are going through powerful stress as well. So both those people will have some sort of satisfaction that there is an appointment. Not somebody's going to ring me or send me a letter out. To us, we feel that that's just not satisfactory.
The group uses a human rights-based approach to try and achieve change for people who use mental health services.
What the UN standards and what human rights standards do is place duties on governments to protect rights, and therefore citizens can use those duties to try and hold government to account for their obligations.
It's teaching us how to look at what your human rights are in mental health, how to go about lobbying and trying to get things done, because a lot of people would be, like myself, would be ignorant of what your rights really are.
It's all right us telling our stories and repeating our stories over again. You know, we needed evidence. We needed evidence to back that up. So we got surveys, we went round doors, we had focus groups, and we got people to fill in the survey. So we had evidence to build us up. We also had conferences where we brought in international speakers from like America, England, Ireland, all over.
This model of holding government accountable to human rights mechanisms hasn't been used in other parts of the world.
And I think all of us agree that the way you've presented this is something that is manageable, and you will be able to see the difference that you're making, which I think is incredibly important, because the problems are so enormous. I think it's important to sort of think, well, how are we going to start this process?
What is the incredibly impressive thing with this group? Everything is rooted in their determination that others will not experience the suffering that they have had. But they have found ways of expressing that with rigour, with international evidence and support, using our work in the PPR project to give them that. It's still expressed in the needs for dignity and respect of those who are experiencing despair, but it's expressed in ways that are based on international obligations, international good practice, and they're bringing it with good heart to power and exercise of power. Why wouldn't you use it?
The panel of human rights and mental health experts recommended that the health minister implement the Card Before You Leave scheme. We lobbied the Health Committee, which made Card Before You Leave a recommendation in its May 2008 report into suicide and self-harm. Later that year, the minister formally committed to putting Card Before You Leave in place across Northern Ireland. The implementation board was set up to oversee the process.
When the group first got involved in the Card Before You Leave board, it set down indicators for what they thought meaningful participation should be. And this was based on their experience on other boards where they feel like that they weren't properly involved in the decision making. And the Card Before You Leave board incorporated these participation indicators into their terms of reference, and the group was very pleased about that.
Subsequently, the group became concerned that these indicators were not being adhered to, and that their participation was not as meaningful as it should be. It also became clear that there was inconsistency across the trust as to how the card was to be implemented.
Minutes weren't arriving on time, agendas weren't arriving. Sometimes we had to chase up when the dates of a meeting was happening, or maybe meetings were postponed. Just very frustration. Just to seem to sense that and then the trusts were, some of the trusts were starting to have their own definition of what they seen the card before you leave.
We asked for written assurance from the minister that Card Before You Leave was just that, an appointment card given to the patient before they leave hospital. Unfortunately, the written assurance we received was ineffective, and the scheme was rolled out with only 2 of the 5 health trusts implementing the scheme in the agreed format.
They're handing leaflets out with suggested phone numbers if you need help, and a follow-up phone call, which it's proven not to be working.
They say they'll give you a follow-up call, but I lost my niece 4 months ago, and that's a lot of nonsense. They don't do a follow-up call.
The group held a protest outside the implementation board meeting in late 2010 to insist that the ministerial commitment was properly adhered to.
There's still a lot of anger amongst families who have been affected directly by suicide or people presenting with suicidal tendencies, that they're not getting the follow-up care that they should be getting. And today's about outlining that and putting the first steps in place to ensure that in future people do get the adequate support and help that is their human right at the end of the day.
As a group, of course, we've already set the details of Card Before You Leave and what that means, and the minister, the health minister, has already passed that, and which I pointed out to Seamus Logan that if the minister had already passed that, then why was they doing something different?
And if the ministers aren't going to sit up and take note of what we're telling them, then we'll just have to keep on fighting until they do.
That's it. Stand up and account it, and that's what we need to do.
Yeah.
The journey has been long, and this film highlights the progress that we've made. Most importantly, this is what we know about change. People in power agree we should participate in decisions, but participation has to be meaningful.
Well, the group found that participation is a human right. They also learned that it meant it had to be active, free and meaningful. However, when they went to decision makers and they took part in boards, they realised that wasn't often the reality, and participation was more tokenistic. People were asked to come, but perhaps not to participate actively and meaningfully, and they found it was very difficult for organisations and decision-making bodies to change the way they did business to make sure participation was meaningful.
Just because people have a mental health problem, it doesn't mean that the brain's dead, and they're not capable, of just leading a life. And yes, sometimes you get ill, but everyone gets ill with other things at different times. So what's the big, things?
We're bringing in knowledge that you just can't get on paper from elsewhere. We're living the experience. It's not theory with us. This is what we're living. This is what we are experiencing. This is what we are seeing. And if we can stop something like that happening to our people within the public, then that's given us comfort.
When I came into this job almost 3 years ago, whilst I knew about suicide, I obviously didn't know the full extent or the threat that it was posing in our society, particularly our young people. And it quickly became apparent that local community groups and families, particularly families of bereaved who had suffered this type of loss, knew best how the system worked and knew best where the need was.
So why is participation important? It's generally known, and it's true. It results in more effective, robust, sustainable policies that are meaningful to the people to whom those policies are addressed.
Whenever the health trusts are making decisions like that, people like ourselves and other groups can be able to participate in that change.
A seat at the table is not enough. We must find ways of being heard.
The group were delighted to get a seat at the Card Before You Leave implementation board because they'd campaigned for so long for the change, but it soon became very clear that a seat wasn't going to be enough. They needed to find new ways of making their voices heard, such as the participation indicators, and in that way they could make sure that the change they'd campaigned for would actually reach people using mental health services.
On the board, we felt very excited, I felt very humbled myself, and we thought, this is brilliant, you know what I mean? We're going to be able to change something.
They made it clear that their participation wasn't tokenistic, that their participation had to be meaningful, and they asked for, real involvement. Could they actually chair the meetings? Could they input into the agendas? Could they alter the minutes? Had they a role to play in the development of terms of reference?
The Card Before You Leave board incorporated these participation indicators into their terms of reference, and the group was very pleased about that. And along the course of the time that the Card Before You Leave board's been meeting, the group has been able to refer to these. For example, after a number of meetings, the group became aware that it was very hard to listen to all the feedback verbally on how Card Before You Leave was being implemented. And the group actually said, look, one of our indicators here is that information should be given to service users in a way which is clear and accessible and that there. So we asked for it to be written.
I have been a leader of a large organisation. I would have been regarded as utterly incompetent and ineffectual if I did not have an agenda, a record of what was said, template and proposals in terms of what we were about, how we were going to do it, when we were going to do it, and when it was going to be actioned and a report back to the next meeting.
Decisions were being made before we actually came to the board, so all the decisions weren't being made at the Card Before You Leave meeting. So it came to a stage where we thought, are we just sitting here just because we're ticking boxes? You know what I mean? It looks good for the health trust, that service users are there.
If you're going to create needed change, people who are very able at their jobs and good at their jobs know that if you're going to create change, that they themselves have to change how they do their business.
We use jargon, we have agendas, we organise ourselves in a very kind of HPSS business-like way, and you've been very good at kind of bringing us back to basics and pointing out to us that there are certain things that you need. For example, the submission of papers ahead of meetings so they get an opportunity to read them and perhaps discuss them in fora like this, which actually brings you up to speed with us. Otherwise there would be a wee bit of an imbalance there.
The number of times that we have requested certain things and not got the answers and not gotten the things that we've actually got built into the terms of reference for the board, we kind of feel, enough was enough on this issue, and that's why we did the protest today. We needed to say, no, hold on a minute, we can't go on like this.
The relationship between decision makers and people is unequal.
participation is very important, but it throws up a lot of issues, and it's often not that easy to get active and meaningful participation. And a lot of that is due to the unequal relationship there is between service users on one hand and people making decisions on the other.
But what also is extremely important in the right to health and participation is the process of participation itself. The nature of the conversation that goes on between the various groups, because at the heart of participation is power. And especially in the area of mental health issues, you have a very large differential in power, especially if you're dealing with an institutional mechanism for participation, something that's been set up by the Department of Health itself.
Sometimes it seems when they have discussions with you, they involve a new document, things like that, sometimes you're a bit worried that maybe they're just tick box exercises, that it's not really going to mean anything or make any difference to what's happening on the ground and the services that are provided.
To be honest, I felt that we were not involved in that. It was like we were watching something else that was someone else's.
I find that all the time where sometimes when you're going to meetings, because I might go in a suit, and because individuals who have lots of letters after their name, for instance, are sitting booted and suited, and maybe can say better words than I can, or maybe can pronounce them a lot better than I can, where sometimes it's nearly intimidating and it sort of stops you from asking questions. But it was after my son that died that I realised, you know, what the hell? So they think they know what's going on and what they can do and what happens. They're not going to embarrass me. They're not going to turn around and put me to the side. I'm going to ask questions.
They're not mandated by public policy, by government responsibilities, or by legislation, or by international obligation to treat people who are bringing to them useful information and evidence as people who have to be patted on the head. They are equals at the table with proven evidence to be used to make necessary change. That's validated by international policy and practice that they have also brought to the table who serves who. And perhaps more importantly, who is not serving who.
Information is power. We must be told the whole story.
Information is really important when you're doing this kind of work, and access to information was one of the group's participation indicators. They thought it was essential to make sure the decisions were being taken with them and not outside the room. They felt that the information they got should be clear, so without jargon. It should be accessible, that they can understand it, and it should be timely, so that they get it in plenty of time before a meeting.
One of the key elements of holding governments to account for their human rights obligations is information. And there are many practical ways in which people can gather that information. One, for example, is sending freedom of information requests into the relevant government departments and agencies.
You know, this isn't about me or isn't about Stephanie, this is a group of people. So we need, it's all right when they're telling us verbally, we need that written down so we can report back to the group. They say, right, this is what's happening, this is what's going to be done. And sometimes we find it very confusing with the words that they come off with and the different, you know, the way different trusts operate it, you know. And actually one of the health professionals in the board turned around and says that they actually found it very confusing too. So we actually highlighted that and trying to make it a bit easier for them as well as for us.
They are concerned that they are not clear about why the Minister's definition in November 2009 has been changed. How has that happened? At the moment they want a clear written explanation of how that happened, why it happened, and until they have an answer to that. And that's what they brought up at the Card Before You Leave board today. They want to know, they want transparency or clearness about that decision-making process.
Government and its agencies are accountable for commitments they have made. We have to use different ways to hold them to account.
Government ministers are accountable for the human rights commitments that they've made at the international level. Civil servants, bodies such as the Card Before You Leave Implementation Board, they are meant to deliver on those commitments. The group have learned that they need to find ways to make sure that human rights commitments are made. This has included things like freedom of information requests, the media, campaigning, and using the health committee.
The good points would have been, well, at least we've got these people here, but are we going to get any results, positive results from this? Because you don't always, promises are made, but promises don't always be kept.
So it's about getting all the evidence together and producing it, and then turning around and presenting it to the health committee, presenting it to the health minister, presenting it to the trust. So we've got all this evidence here. Now you tell us what you're going to do.
If we don't go in and ask the questions, we're just going to get what they want to give us. If we don't put across our point, which is why we're really here today, well then we're going to be left just as things were before.
I've felt since being put on the health committee in Stormont that without pressure being put on various issues, things tend to just drift along. And I certainly don't believe the card before you leave scheme would have happened without the pressure.
And we have an excellent health service in Northern Ireland, but sometimes it's slower to react than perhaps it should be. So that type of campaigning and that type of bringing it to the public attention does affect a change that comes about more quickly.
There are many ways to hold governments to account. I think people often think of human rights as legal and therefore you must go to court to vindicate your rights, but legal tools are really only one element of what should be a wider sort of package in terms of accountability. There's obviously political accountability. The minister in charge of the relevant department, so in relation to the right to health, the Minister of the Health actually bears responsibility. So there's political campaigning that can be undertaken to hold the minister to account for his obligations. There are also then more administrative forms of accountability in terms of ensuring that all the various agencies tasked with protecting the right to health are doing so. And then there's campaigning, and use of the media and public information can be very, very important in terms of raising awareness of problems and building profile in relation to them, and therefore putting pressure on the relevant authorities to do something.
This group has expressed in their work not only their wish that the other families don't experience the same that they do, they have restored to their loved ones the dignity with which they were not treated when they needed it.
We have learned a lot through our work. We knew that getting real change was not going to be easy. Compared to those who make decisions about health services, such as the minister, civil servants, and politicians, we have little power, but we have to find ways of building on the power that we do have.
What we do also we need the government here. We need the government to sit up and take action and see about these children, see about these people, not only children, men, women, people with all this suicide. They need to sit up and take action about all this.